I'm Dr. Dan Knotts. I've been practicing medicine for a long time. I've actually been practicing addiction medicine for almost 35 years. It was a time when basically we had almost nothing that was particularly effective in treating patients with opioid use disorder. It was very difficult because the patients were very uncomfortable. They were very frustrated because we had nothing that really helped them. And often they left against medical advice. It was a hard time. And when medication became available that was effective, it was just like antibiotics. It was that dramatic. Basically, traditional treatment, that's for years was basically a 12-step model. The outcomes were terrible. Using an abstinence-based model without medical support, recovery rates like 7 to 10% are not unusual. And, it became very clear that traditional treatment as usual just doesn't work.
I've come across a lot of individuals who struggle with substance use disorder and also often struggle with chronic pain. And it often felt like a very frustrating condition to manage because I didn't feel like I had great tools to help with either of those conditions. And at first I was a little bit skeptical, especially around using a medication called Suboxone for opiates. But after exploring it more, after educating myself more, I ended up getting what's called a data waiver, which allows me to prescribe buprenorphine products. And since that time, it's become, honestly, the favorite part of my practice. I've seen people's lives just transformed, partly because of the medication, but also partly because they're engaged in their healthcare, they're engaged in their lives, they're able to reconnect with family, and it's just been an incredibly rewarding thing to be part of.
If you came to see me with an opioid problem, and then I really have nothing to give you, it's a very frustrating situation. Often physicians used to say, we know you're going to have withdrawal, but you won't die from it. That is not reassuring because it is extremely painful and you feel like you're going to die. Addiction's is like your brain's been hijacked. And that's really quite appropriate for opioid use disorder.
They are in pain, they are struggling, and the narrative out there that somehow this is a choice or that this is some kind of moral failing, I mean, these people this is torture for them, and many of them so desperately want to get help, so desperately want to quit, but the reality is it's really, really hard, and there's a lot of, again, chemistry, physiology that they don't have control over.
You're on the spectrum of anywhere from mild to moderate to severe, and we treat anyone who scores for moderate to severe, and it's really just how much is your opiate use ruining your life, right? And if it is causing any kind of strain to your life, then chances are you probably have an opiate use disorder, and it is a chronic illness. So just like any other chronic illness, as a primary care provider, it's something that we should treat so that way we can increase their quality of life.